Doctor, you mentioned oximetry. Yes, oximetry, meaning the measuring of the amount of oxygen in a series of blood samples, either chemically or by reading cuvette oximeters of the samples obtained through catheters from each heart chamber or vessel. Doctor, the perfusion in intracardiac surgery is what? That is a method of providing oxygenated blood to the body by a heart-lung machine while interrupting the circulation through the heart. And doctor, the elective proceeding for converting certain tachyarrhythmias to normal rhythm is known as what? It is known as cardioversion. And cardioversion is in the emergency procedure? No, it is for controlling ventricular fibrillation. It is usually referred to as defibrillation. Doctor, what is sphygmomanometer? Sphygmomanometer is the instrument measuring blood pressure. And a stethoscope? A stethoscope is an instrument for listening to sounds within the body. Doctor, what are synchronized direct current counter shocks? They are electric shocks producing cardioversion by the use of a synchronized capacitor. The synchronization is contraindicated in ventricular fibrillation. Doctor, the transducer is what? That is a medical use, a transforming device which transmits energy from a patient to a monitoring machine. And a treadmill exercise tolerance test, that is a stress test for evaluating the ability of the coronary circulation to meet the metabolic demands of an increasing exercise head or load. The patient electrocardiograms show ischemic changes. And the two-step exercise test, that is a master's test, an exercise test of the coronary reserve. Within its 8-minute reserve, the patient goes up and down 15 to 25 times, 2 steps, each 9 inches high. A post-exercise electrocardiogram is taken at once. If it is negative, a 3-minute double 2-step test is performed. As soon as the patient experiences pain, the exercise is discontinued. Doctor, what is Valsalva's maneuver? Valsalva's maneuver is an effective treatment for paroxysmal atrial tachycardia and similar disorders. The patient is obstructed or instructed to inhale deeply, hold his breath, exhale, and then strain strain down forcefully while slowly counting for 10 seconds. The Valsalva maneuver is also used as a test for cardiac reserve. Doctor, what is anasarca? Anasarca is a massive edema with serious effusion, especially in the right pleural and retrotoneal cavities. If it occurs in the right heart failure, there is systemic congestion. What is anginal syndrome? Anginal syndrome or anginal pectoris is a syndrome characterized by short attacks of substernal precordial pain, which radiates to the shoulder and arm. It is provided by exertion and provoked and relieved by rest. What is Anschoff's bodies? That is a nodular lesion of the myocardium, pathognomic, characterized by rheumatic disease. And asystole? Asystole is the cardiac standstill, no contractions of the heart. And bradycardia? Bradycardia is a slow heart action. What is cardiac edema? Edema of the or retention of water and sodium in congestive heart failure due to circulatory impairment. Doctor, what is cardiac syncope? Cardiac syncope is the fainting associated with marked sudden decrease in cardiac output. And cardiogenic shock, that is a syndrome related to cardiovascular disease, primarily to myocardial infarction, cardiac tamponade, massive pulmonary embolism, or others. It is clinically characterized by mental torpor, reduction of blood pressure and pulse pressure, tachycardia, pallor, cold, clammy skin, and signs of congestive heart failure. What is carotid sinus syncope? That is a vasopressor type. And ischemia is the reduced blood supply to an organ, usually due to arterial narrowing or occlusion in advanced atherosclerosis. And cerebral ischemia is a local anemia in the brain. And myocardial ischemia is an inadequate blood supply to the heart muscle. Call it a day?
Yeah, I can call it a day.
It's 6:30. It was a tough one. I'm gonna take a nap.